It's the second week of your 40-week pregnancy journey. Just like week 1, you still aren't technically pregnant, but you're closer than ever to that goal. During week 2, your body is getting ready to ovulate. To maximize your chances of creating a new life, now it is the time to pay attention to your body's subtle fertility signals and spend some quality intimate time with your partner. Remember, your healthcare provider calculates your due date and the 40-week countdown from the first day of your last period. So, if you just had a positive pregnancy test, that's a blessing for you. Your baby's development at week 2. While there is no fetal development at this stage, it's coming and your body is preparing for it. In your ovary, an egg is maturing and getting ready to break free. Meanwhile, the lining of your uterus is growing and getting thicker to accept and nourish a new life. At the end of the week, ovulation will occur as your ovary releases the eggs into your fallopian tubes. An egg can survive for 12 to 24 hours after ovulation, but you don't have to have sex on the exact day of ovulation. Since sperm can live up to 5 days in fertile cervical mucus, you can have intercourse every other day during week 2, or time your intercourse a day or 2 before ovulation to get the sperm in place, ready, and waiting for the egg when it is released. Millions of sperms that start the journey to the egg, only a fraction of the healthiest and the strongest will make it to the fallopian tube. Once there, only one will enter the egg. When the sperm and the egg join together, it's called fertilization. Your common symptoms this week. With your period in the rear view mirror, you may be feeling pretty good this week. You may not have any symptoms at all, or you may notice a few changes in your body. You must keep an eye out for the following symptoms. First one is cervical changes. As you approach ovulation, the cervical becomes high, soft, and slightly open. Cervical mucus, which was thick, sticky, or creamy, begins to thin out. It becomes clear, watery, or very stretchy like a raw egg white. Watery and egg white cervical mucus allows sperms to survive and swim to the egg that will soon be released. The second one is increased sex drive. Nature always seems to have a way of knowing what you do. Hormone changes leading up to ovulation can give a boost to sexual desire during the most fertile time in a woman's cycle. If you feel a little more passionate than usual, you're probably approaching your ovulation. The third one is fertile saliva. As ovulation approaches, the hormone estrogen increases. Rising estrogen causes changes in saliva. When you look at it under a microscope, dried up non-fertile saliva looks like dots and lines, whereas dry fertile saliva has a ferning pattern that look like branches of a fern plant or a palm leaf. So let's go through some of the self-care tips during this week. Trying to conceive can be exciting, but it can also get you stressful, especially if it's been a few months. Be sure to care for your physical and mental health this week. Number 1. Care for yourself. Eating well, engaging in regular exercise, and getting enough sleep can help you feel good and fight off stress. It can also put you on the right path to maintain a healthy weight and stay within the recommended guidelines for weight gain during your future pregnancy. The second one is take your vitamins. Start or continue taking folic acid or a prenatal vitamin to get all the nutrients you need to stay healthy during pregnancy and help prevent health issues for you and your coming child. The third one is trying to reduce stress. Typically, everyday stress is not likely to interfere with getting or staying pregnant, but high levels of stress and the pressure of trying to conceive may negatively affect fertility. You can try to keep stress under control by practicing relaxation techniques, meditating, taking a walk, or spending time with friends. If you find yourself overly stressed or anxious, you can talk to your doctor or a mental health specialist. The fourth one is connect with your partner. Try to keep sex an enjoyable experience between you and your partner. Sometimes, when too much focus is placed on the goal rather than each other, it can seem more like a job. Talk with each other and try to communicate as openly as possible and share your feelings. So, in the nutshell, here is your week 2 checklist. Pay attention to your body and look for signs of increased fertility. If you're unsure when you'll be ovulating, consider using a home ovulation test. Engage in sexual activity as you approach mid-cycle, notice fertility cervical mucus, and feel an increase in your sex drive. Continue taking folic acid or prenatal vitamins. Seek out ways to keep stress and anxiety under control. Thank you. Please like, subscribe and share our YouTube channel The Voice of Woman and press the bell icon to stay tuned for the latest updates.